Okay, so a lot of what I got from the chapter this week was based on like the inverted pyramid method,
Mhm.
which I thought was really cool. It took me a while to understand really what it was saying, but then once it got into talking about like intake sessions and how it was structured and the different approaches, then it made more sense to me. But I have a question for you, Kyle. When you do like intake interviews, do you have yours set up like the picture it showed in the chapter, or is it more unformalized?
It's interesting. I've done these things before, and after having read this and seeing the inverted pyramid, that is exactly what it is. Even though I've never like formally thought about it that way, that you're starting with a very broad concept and then you're narrowing it down as specifically to targeted as you can. Um, so I haven't thought about that picture, but that is very much, in my experience, what it looks like.
Well, I like that idea because you don't leave anything out. I think it's real easy to pinpoint on a thing or two and go,
Yep.
there it is, instead of opening all the doors and going, oh, hold up. This might connect to this, which can also open these doors. So
Exactly.
it doesn't get you tunnel visioned immediately. It's like the
Yes.
old detective who automatically says, the girl did it. So
Right. I mean, it literally is deduction, right? In like the Sherlock Holmes sort of way of here's all the possibilities. We'll eliminate this, eliminate that, and then whatever you have left is usually the the answer.
I really appreciate that the whole inverted pyramid, it basically says it's casting a wide net. So
Yep.
you kind of just meet the problem where it's at, and then you start narrowing it down. Well, yeah, narrowing it down to like what you need to primarily focus is like what care needs to be in place, what treatment plan needs to be in place, and how to really pinpoint everything. And then that way, say, because I know we previously mentioned last week, like say if something doesn't work out or it doesn't just work with the way that you're approaching it, you've already made that pyramid. So it's going to be easier for another counselor to identify those problems and then maybe think of a different theoretical approach.
Right. Because yeah, the how you integrate your own, what do they call it, theoretical interference.
Yeah.
How does my approach color what this is and what might someone else say? That plus the cultural considerations and all of that. Just, yeah, a wide net, as it's said.
Yeah.
Hmm.
I
I
think
also really like how kind of like how you guys all said already, but like I like how it's everything is there. So then like you can kind of like when everything is just like right in front of you, you can easily kind of see things instead of being like, oh, there's this and then there's like because I know like with me and like how my brain works, I'm like, oh, and I might get on a tangent if I don't have like all in like a nice little inverted pyramid. And if like, so to have it all right there, like it doesn't, it allows me to stay like focused instead of like being like, oh, well, it could be this, and then like go off like completely sideways.
Right. Or like Derek said, the tunnel vision of you're just kind of following this path, then this path, then this path, rather than like here's the horizon and here's um, narrowing down more and more how we get there.
And then it's easier to pick your clinical approach, your theoretical approach, your clinical model, because you can see everything in front of you and see like, okay, like what could really go best with what I'm getting information on based on this sheet versus not having it in front of your face and then being like, I'm hearing what you're saying, but I really don't know where to put this into what category, so I'm not sure what way to approach it.
Right.
I think that's probably going to be the harder part for newbies, other than my own general personal experience from before. And I think that's going to be, and I do like that the book makes that clear. They say seasoned, counselors are going to already have their layout, kind of have a process already, and it's going to be easier for them versus us who are maybe starting out. And so I do love the fact that they kind of open the door to the theoretical approaches, but I think that's probably going to be the area that I'm sitting here all the time going, I need to go back to my book and really spend some time narrowing down some approaches that I feel more comfortable because they kind of said pick your one or so. but I really need to really dive more into being comfortable with all the approaches so they can connect easier. Does that make sense? Because I feel like I'm gonna
Totally.
not connect them as easy as I probably should.
Well,
No.
that's what a lot of the more seasoned counselors say is that everyone does a hybrid of something at some point because you kind of pick and choose what works with what. But at a certain point, your main approach is going to be X. And, if you're a cognitive behavioral therapist and you see that what this person needs is psychodynamic, well, there's only so much of one or the other that you can be an expert in before you'd be like, well, maybe we can refer you to something that's what you need because we funneled out, these specific things that I might be able to help you with.
Yeah,
Right.
what I've noticed a lot, especially when like looking on Psychology Today, a lot of seasoned therapists say like I use this approach. Let me know if that's a good fit for you. So going into it, okay, this is what kind of approach she uses. And then they'll use like another approach to give like homework and whatnot and be like, oh, look, this is a homework that I pulled from blank. But what I've noticed, I think they like do like the actual sessions and like their primary approach, and then they can sometimes pull coping skills and homework from other approaches. But I feel like that's why they state which one they use. So, going into it, like, this is what I'm comfortable with. This is the one I've learned the most and I had the most experience with. I've never seen a therapist that really used everything and didn't actually just have one approach.
Right. I would
Yeah.
be kind of wary of that therapist.
Yeah.
And I don't know if I want to say Derek for sure. You were in 660, right? Who else was in 660 already?
I've
So
taken
that
it.
with Dr. Beach,
Yeah.
then yes.
So I know like when we started our intake session video, like as our as a counselor, we will all said like this is like the approach that I utilize in this like in my practice. But so like I'm curious to see like how much of that we'll be doing also like once we start to like just kind of lay that line of like during our intakes of like, hey, like this is the approach or these are the couple approaches that I tend to stick with, like just so it's kind of cool to do that class before this class because then it's like I don't know, we kind of put it into practice and now it's like, okay, well, it kind of makes sense now, like why we did that or why we wanted to do that.
Right. Because like the average client isn't going to know the difference between cognitive behavioral and Gestalt theory. I've seen on Psychology Today that they have those things listed, but I do wonder if the average person's looking at it and being like, okay, I just need to talk to someone.
No,
Yeah.
I think they generally probably do just don't even it flies over their head. And I'm sure after like maybe a few months they understand kind of about it. Because when I went to my therapist, she knew that I was like a graduate student counselor. So she was like, I'm doing person-centered approach. But if you would like, I don't mind throwing in some other techniques just to help you out so you can kind of see how it is done in a setting, which was nice of her to do. But being in this class and all these classes has helped me realize though how she does it, and I really like that, and I like being able to pick up also on the different approaches. Sometimes she'll throw in for like homework and stuff, and I feel like that's something someone who is not a counselor or in the medical field would not pick up on, and it probably would take a long time to pick up on because they would just think, oh,
Yeah.
this is just a therapist giving me some homework.
Right.
Right.
Even if they could identify the aspects of that approach that they like, oh, I like that I'm being given these tools. I like that it's centered on my autonomy. Even if they don't have the right labels for it, you can kind of feel the difference, I think. How have you guys been coming on your approach crafting, I guess, in terms of this is what I want to focus on as a practical counselor?
I really do like person-centered because being in the client's shoes, I like being able to talk about what I want and kind of let it just flow all out, and then she just listens to me versus when I've done other types of approaches, and they would ask me directed questions, and then it was like, well, I didn't really want to talk about that today, but I guess we can since you brought it up. So I like honestly being able to say what I want to say. And I feel like that's important because then as a counselor, you get to see what's actually going on in the client's mind and letting them talk about what's bothering them and letting them do on their own pace versus feeling you have to ask questions to get to the part that you want to talk about. If that
Yeah,
makes
they get to drive the bus.
Yeah, like when I was doing my volunteer work with the 988, that's the approach that we would use because again, when you're on the phone and you have to really like dive into like what that problem is in that moment and you're not sitting face to face with them, you kind of have to do that. It's like you can ask a certain question, and but this is how they trained us, where you have to ask a specific question, but they don't realize that most of the time they're just going to flow with it because they called for a reason. They called to look for some form of a problem solving. So they're just like, you're literally going to ask questions A, B, and C, and they're just going to go down the entire road of just saying, well, it's because of this, it's because of this, it's because of this. It's giving them that environment of a safe place to basically express themselves and be like, okay, well, this is what's wrong. And then that way you just kind of go back through it and you're like, oh, okay, this is in correlation with that.
Yeah. And of course, to bring it back to the chapter, this is all going to help with those case conceptualizations.
Yep.
It's almost like knowing what your intention is, it can kind of help give that direction.
Yeah.
I still feel like a more flexible approach is a good way. And I think they're pushing more for that, even
Yeah.
though Kyle said he wouldn't trust me if I did too many theories.
Well, no.
I'm having fun with it. I've got to joke at least once in one of these
Oh
videos.
no,
Oh
it's
yeah.
no, definitely. I think that everyone is a hybrid in some way.
Yeah.
You do pick up things as you go. Um, yeah, having at least a basis of knowledge of all the different approaches makes you as well rounded as you can. How can you even know what the best approach for you is if you haven't, learned about them all?
One, I found personal experience from more of a Adlerian approach, I guess would be the best way I could put it.
Mm,
Um, for me and my personal experience of things I've went through and done and dealt with, that I think I'm more connected to that, but I don't know if I'm kind of backing up, like to your question earlier, Kyle, to go, hold up. When I'm looking at this, maybe I need to go a little bit differently because CBT is real big across a couple different platforms because of,
yep.
just success that they've, evidence-based practices and, with depressive disorders and other things that it's going to be probably a good key to put in that I go, maybe I ought to back up from just my personal thought and perception immediately and try to have a more observant view when doing this and not making it too personal while I'm doing this.
Yes.
I
Yeah.
think, and I feel like I'm going to say this like in every way this comes up, but with it being like me being in a rural area, we have, I'm going to say there's 3 like independent like counseling agencies. And I apologize, my children are being noisy, but they're in a pool, so I can't leave them unattended completely. But so I wonder, like in a rural area, if it is like more of like you kind of like are like a jack of all trades because there's only like 3 different agencies that are in the county. So like with only 3 agencies that do like the like individual counseling, like mental health counseling, it would be very difficult if it was like, hey, I only do like this approach because there's a good chance that like if that approach doesn't work, they might not have anyone in county that could see them. And then you're creating another barrier of like, well, now you
Hmm.
gotta go to a different county or only telehealth, which not everyone likes telehealth. So I wonder how that like will change based on the location of where we end up, which I'd be interested to ask like where I work now is one of the agencies. So I'd be interested to ask like counselor who owns it, like what kind of like how does she typically handle this?
That's a good point.
Yeah.
That'd be an interesting study of like rural or like what's your population density and then how flexible is your approach? Like what's the correlation of that?
I feel like all research is super interesting, like the data, like I like am super fascinated by it all.
Same.
Well, I was going to ask because I know that Kayla, she had brought up the inverted pyramid wait, hold on, the inverted pyramid approach. Sorry, I can't talk today. I know that in the chapter it talked about the mental status exam. So I guess my question for you guys is like, what approach do you feel like was better for you, like the mental status exam or the inverted pyramid approach?
Well, it's actually talking about using both from what I'm
Yeah, I
getting.
feel like they flow into each other well.
Yeah.
Mhm. And so in our other class, we're doing the MSE.
Mhm.
So you're experiencing doing that. That was one of the last assignments. So I did appreciate that because I don't know if I've really maybe I'd already kind of done it subconsciously, but I looked at situations based upon somebody's cognitive abilities, how intelligent they really are, what they can handle, that kind of stuff. I think it's a natural to do that, but I think it's creating a way to be more cognizant of certain things you look at to connect them more than I used to, maybe. Like the reason why they're doing this may add to, more depressive because they don't feel good about themselves because they don't feel as intelligent, and it can add to certain parts more than what I think I saw before. Maybe
Right.
about putting that in there. And then also, before you think there's another true diagnosis, it may just be parts of that are due to what we can figure out in the MSC.
Yeah,
Totally.
like the inverted pyramid method. That's something that's like flows over time throughout all of the throughout all the sessions. And it's more of like a workbook you're working through. And I see the MSE is something that you do in the initial like intake session that you would do, I think, subconsciously anyways. Like you obviously wouldn't ask your patient to like count from 100 and down. We all like I'm sure we all are gonna ask your patients questions just to know who they are, but also just be like, okay, like let's see like how your brain works and how is your brain thinking and are you fit to live alone? Like, I feel like there's questions that therapists will ask that we might not realize that they were asking to see if we were healthy and stable. But so I see like that more something you do regardless, just because you want to make sure your patient is competent and safe. And then the inverted pyramid system is more something you do that flows over time. That's not
Right.
supposed to have an exact answer within the first session.
Right.
But I know when we did clinical assessments at like through community mental health when I was a case manager, they actually did do like subtraction. Usually, I want to say it was like by threes, not by sevens. But
Seven
it
was
was
hard.
interesting because like in the yeah, sevens are hard for everybody. Like but in the clinical assessment is like there's like a mental status like section where it does go through like a lot of the different things. So like again, it's cool for me because I'm like, well, I was forced to do these things without like understanding or being trained on them. So now it's like, well, it's kind of cool like being trained on them now that like it makes sense some of the things that I've done in the past now.
Yeah.
Like reverse engineered.
The subtraction thing, it was kind of like I did it with the person I interviewed, and it was kind of fun to see how we actually like were writing and like figuring out a way to figure it out. And it was like it's not just to see if you can do that off the top of your head, but I think it was also to see like, well, you take the time to actually problem solve and figure out the way to make it easier to get to the end, or would you just give up immediately because you're also getting frustrated? So I was like liked how I think in my head it showed a lot more than just actually subtraction, if that made sense.
Yeah.
Yeah.
Yeah, problem solving that key. But I do think that some of the memory things do help with connecting dots because the person I did the MSE thing with, I could see some of the presentations of stuff she already talked about come out with the memory and issues like that. 'Cause she's like, I got ADHD or this or that. And so some of those memory connections or other things that go, oh, that's probably part of it. Because
Hmm.
parts were easy to remember. Other parts were like, oh my God, I can't remember yesterday, but I can remember last year.
Right.
And so it's like, what did I do yesterday? Like, there it is. So it wasn't about not, some of it could be a true memory issue, but other parts can be connections too. I just started to see some of that.
Yeah, and again, that's just what the funnel helps with so well is it's all about those connections. I mean, so much therapy in general is finding those connections of how is this thought relating to this symptom that's coming in,
Mm.
or this past experience is influencing this thought I'm having right now.
Right.
So I am comforted that they said over time you'll just make the connections a lot easier.
Yeah.
And again, I think I do that part fairly well because I've done that a lot already, just connecting dots. Now it's just making sure the dots are connected in the specifically right way to the extension of true diagnosis or other areas. Because that is probably one of my stronger suits is connecting dots.
It's like connecting the dots, but we have to make sure we like they're like the dots that are in like the number order to like make a picture. Like we have to make sure we're following all the numbers. We don't skip a few numbers.
Right.
It reminds me of that. It's like a new Disney thing. It's like a little like coloring book, and you're like coloring it in like paint by numbers, but you think it's gonna be one picture, and then it ends up being like a totally different kind of picture.
Yes.
I don't know if
Yeah.
you've
Oh,
seen that
that's
TikTok,
cool.
but it looks really cool. And that's how I think of therapy is like, okay, you think that this is gonna be how the conversation goes, and then in a year it's like, okay, no, we fully like you're telling me things I would never have expected to hear, but then you get to the very end and you're satisfied with all the work that you've done.
That's an amazing metaphor.
Yeah.
Yeah. I was gonna say that when you explained it like that, it kind of just gave me that good itch in the back of my brain, like, oh yeah, she's right. Because like when you do that, it just kind of broadens the horizon of everything. And it's like, oh, okay.
And then clients they go in thinking that they're going in just to talk about this like one situation or this one topic, and then
Mm,
start to get asked questions and start to, I think, realize as they're saying things out loud what they actually mean. And they're like, okay, wow, I did not realize that like this is how therapy was actually gonna go. Because they always think that's more of like a you talk about your I feel like when they go for the first, I think it's just talking about like this one specific problem. But I don't think they realize that like truly as counselors, we want to know everything about their life, even if it's like, what did you do last night? Like I don't care if you want to talk for like
right.
you did in the last 30 minutes of your night last night, because that really will explain a lot. And then they start to realize after a few sessions, like every part of my like day does matter, and that like leads to the big picture.
It's kind of
Right.
like the iceberg theory, if you guys know that. Like it's like
Yeah.
surface level, and then in the bottom, it's like you said, the client is there to come from like, oh, well, I'm depressed and I have suicidal ideation. They're thinking they're going to talk about that, but then the counselor is going to go under the water and kind of scratch at the what is it? The surface level and then the undersurface level. It's like everything that's embedded within. That's
Yeah,
not
like
laying
how
on
I
the
see that's
surface.
like I forget if it's like the ego or the ID that's first, is you're going from like the ego
Yeah.
or the ID, whichever one, and then you go all the way down to like the super ego that's like so
Yep.
subconscious you don't even realize you're doing it.
Right.
Right. And then you add the fact that that iceberg is always shifting and those numbers are always moving because people are constantly growing and changing. So over the course of a year's worth of experience is going to maybe change your outcomes or color them differently.
Right.
I was just talking to one of my groups about this earlier today. That the theory that every 7 years, every cell in your body is replaced by a new cell. So we are
Mm.
always brand new people. The same goes for our minds as well. We're always changing and growing, and that makes coloring in those numbers especially tricky.
Right.
Talk about tricky. There's never been a case so far that I've seen them talk about schizophrenia. And I'm telling you, some of the hardest to work with when they're in intense conversation of paranoias or delusions. It's like
Oh yes,
you can't even get anywhere. So I'm like, please put this in the book. I need this because sometimes you just feel like you're banging your head on the wall. You're just like, okay, whatever, man. I
yes.
don't know what to tell
Hmm.
you. Great,
Yeah,
you
that
know.
actually reminds me of when I was going for my bachelor's degree, I had a professor named Dr. Sarvar, and he said that he had put two people in a room. He believed that they both had schizophrenia with something else, but they convinced both of themselves they were Jesus. So he put both
Hmm.
in a room to see what they would do, and they just had a fluid conversation about how this person is the Messiah, this is the Messiah, I can do this, I can do this, and he said it was just really it was funny because he had a funny sense of humor, but it was funny to watch that because both of these people have convinced themselves that only they can control everything in the aspect of life and that they're Jesus.
Hmm. You really do have to have a sense of humor when working with that specific population. I really believe that. Otherwise, it will drag you down. I have a group today and a group tomorrow that has a lot of people with that diagnosis in it. And yeah, like you said, Derek, it is sometimes really frustrating and you feel like you're just banging your head against the wall. Um, Yeah, it's by far, in my experience, the hardest population to work with.
Yeah.
Well,
I
I
feel
think
like
you have to have a lot of patience.
sometimes you have
Yes.
to put yourself sometimes in their shoes and kind of imagine what they are seeing or what they're saying or what they're hearing and think, how would I respond if I was going through that, and then answer that way. 'Cause I feel like if you don't go sometimes in that approach, they might think that you're just like making fun of them. And it might be just
Hmm.
easiest to act like the same thing's happening to you. So that way you can at least kind of be like, okay, I can kind of see how they're feeling. Let me ask a question that I would want someone to ask me versus just fully being like, what are you talking about? What do you mean bugs are crawling on your skin? We're sitting in a very clean room. They're not going to understand that.
Right.
I also think it's super like interesting when you have someone who like you're working with and then they like develop the schizophrenia. Like that is a wild thing to like know like all your previous like interactions and then like watching how they completely change. Um and that's something that like I don't know, it's like you read about it, like you understand like this is what happens, but then to actually like watch it happen and like be engaging while like this happens is like it's just fascinating.
You mean seeing it develop over time with a client, or like in a single
Yes.
session seeing it
No,
crop up?
over time. So like
Yeah.
you have multiple months like with them and then all of a sudden it just it's that right time and like it's like wow.
Yeah.
Like super fascinating.
Yeah, I've never had a client like that, but I have had a family member like that.
Yeah, I was gonna say I've had some people I've worked with that way. And I think the biggest thing I try to do is one, be patient, to not dismiss everything.
Yeah.
I try to go along with parts of it and be able to
Mhm.
make connections that are realistic in certain ways. Because I think that helps to keep the conversation going. Otherwise, you can't get any of those parts like they're talking about in the book if you're having a conversation and you just shut things down, or they feel like you're judging or things like that. You're going to limit what you're able to actually get. So,
Right.
And then if they are on medication and you are starting to make groundwork and you're starting to find common ground and then they stop taking their medication, it can feel like you're going fully backwards. So you have to rework
Hmm.
everything you've done because then they believe again that medication is not going to help them. Then you have to go through all the hoops and loops to get them back on the medication and rework the brain again.
Right.
Yes.
Speaking of medication, I know this is again like a side conversation. But I know like when I watched that video on the like different disorders, it was like super helpful to me, like how they like explain like the oppositional defiant disorder, like conduct disorder and all of them and they how they like showed the like slight differences about like when sometimes like someone will feel remorseful after the situation happens or like medication does not work and like to me like at the as they talked at the end like I would screenshot the video because I was like it's like super easy pictures of like medication doesn't work for this like this is how their feelings if they're consistent so I like really loved that specific video like I think that was my favorite one that we've watched so far in this group in this class and I'm like I want to see if they have like a lot more videos on like different things we learn because I think it would be for me it's like super great I don't know if anyone else had the same like reaction to it.
It's a lot easier to hear and see something versus just read it. And you're reading words that I mean, you know the words, but you don't know what the words mean when they're all put together. And so it's a lot easier to see things in front of your face and see them being acted out and described. It's like, okay, I now understand what this inverted pyramid scheme might mean or what this might mean because I'm seeing it actively versus just reading it on a white screen.
Yeah, I agree. I will say that I'm more of a lecture type of girl than just, say, oh, read this. Like, oh, okay. Because you kind of, it sets the tone for everything that this person already has experience in. So when they break it down for you to like find an easier way to understand it rather than me find a way to understand it, it kind of helps set that tone to like, oh, okay, that's why the video was so informative of all these disorders and connecting those dots.
Yeah.
I also this kind of as we're talking about that, like I really liked how even though the book talked about like the case conceptualization, the inverted pyramid, like it all make like I like read it and like you like think that you understand it, but it was super nice like with the different cases in the book, because then like you actually get to see it. Like
Yeah.
they explain it, but then they actually show you what it looks like based on this individual. So I thought like to me that was really helpful that not only are they just explaining it, but they're also like putting it into practice for us to see.
Yeah, like
Right.
it was a lot easier to understand like our learning activity this week with Naruto after reading this chapter and then seeing how it's like the gray box and has every little part dissected. And it was a lot easier to answer the questions, knowing kind of how you are supposed to get from the
Mm,
top and the beginning of the general background all the way to the end and it's like current treatment case findings part.
right. I totally understand that. I agree with that.
Back to the vampire. I think it's one of the best ones though.
Yes.
But no, I mean, and I do love how they try to be specific to the attachments to the major depressive disorder, the other parts that are added in. And then also showing how they could disconnect certain areas of, trying to think real quick on what I was talking about. Yeah, where he was talking about the delusion on the vampire stuff. They showed how they were able to slightly disconnect that from the specific diagnosis. Like those certain areas where they said, hey, we heard it, it's relevant to some extent, but here's where it doesn't fit within this diagnosis. Um, I did appreciate that because I think it'd be easy to attach everything. Like at this, at this, like the Oprah effect or something. You get a diagnosis and you get another diagnosis and another diagnosis.
Yeah, it's important to remember like what serves the person, what serves the situation. If
Mhm.
you're just labeling for label's sake, it can end up doing more harm than good because you end up putting people in boxes.
True.
Right. And they get misdiagnosed oftentimes, and then they find out they've been misdiagnosed. They've already went through certain medications, different approaches, different therapies that were not specifically designed for them. So that puts them in like this box, like you said, Kyle, like, oh, well, this was completely wrong for me from the start. I have to start from square one. I have to start over. I can't, it's a lot of like, it's kind of deforming that person as an individual because they feel like, oh, well, if they misdiagnosed me, then what if the next counselor misdiagnosed me? And then what if that person and that, and it kind of makes them more reluctant to go back to therapy if you think about it.
It
The one that
could,
really sticks in my mind, because I think it's just like a really common thing right now, is the sort of dichotomy between autism and ADHD. Has anyone else noticed that? That a lot of the times it can either be this or that. And those are two very different things with very different expressions, except for like some commonalities.
Right.
Really important to get those sorts of things right because those need completely different methods of treatment.
for sure. And I agree, Mackenzie, it's kind of defeating. And that's the thing. Once people start to feel hopeless or defeated, it's a long train coming back. Because then you
Yeah.
spend a lot of time just trying to get them out of the hole or you
Hmm.
Yeah.
try to go forward.
Yeah, and in a way, it kind of puts them in a bigger hole because, like, they feel like they made all this progress, but yet they still felt like they're missing something. It's because it's just wasn't targeting the specific areas for their symptoms because it was so similar to another one, like Kyle mentioned with autism and ADHD. You just really got to find that difference because if you don't, you're going to be doing more harm than good.
Yeah.
I think that's why I get frustrated with typical overworked, overfilled community action agencies who
Mm.
are
Mm.
running quickly at just slapping stuff because I've seen the progression of exactly what you're talking about.
Yes.
I'm looking back and talking with people, and they're like, well, it was this, and now it's that. And we went here, and then it changed to this. And it's like, wow, like that's not cool. So
Right.
I agree completely.
Yeah, it ends up being inefficient because you're just desperate to get help to these people.
Yeah.
Even if that's the best place that it comes from, it still ends up doing harm at the end of the day.
Oh, for sure. And I hate to say it, but money's always a factor.
And also that.
If there was more money, then they could spend more time.
Yep,
Yeah.
more money, more people.
Yeah.
Yeah, that's why we have a opioid epidemic.
Nope.
So
The learning activity.
that's right.
Perfect. Mackenzie, I think you said that you had the questions ready for easily accessible.
Yes, I do.
Perfect.
Okay, so I know it was talking about the four elements of treatment planning. And basically in the book it said what problem or problems were selected as targets for change in the treatment plan? From where in the case conceptualization did the counselor identify this problem or these problems?
I saw the problem that I focused on was like the hyperactive impulsive destructive behavior around school, him wanting to be a ninja, and she like pinpointed that problem based on how the teachers were expressing about their concerns about him in class and the behaviors, and then it went more into as well, like she figured out that problem by them and then also his family history as well and how that started there because they said that he was ungoverned, he could not be like governed, and
Right.
how that like rose up.
Okay, well, the next one I was going to ask is like, because still pertaining to the first part, because we're going down the four elements, how reasonable did you find that the nature of those problems or like, including the main problem of the sub problems, defined in the treatment plan for Naruto?
It felt funneled pretty well to me, honestly. Everything that they had said seemed appropriate. To Kayla's point about um, the way that it was expressing. In terms of it could go depression, could go ADHD, could go ODD. I thought they did a good job with that differential sort of diagnosis.
Right. Okay. Um, so the next one is what goals were set according to the treatment plan? For treatment plan to be successful, the operational goals should be achievable. So what were some of the goals that were set for the treatment plan?
I just got home, pulling them up.
I was gonna say for me, so because the counselor she went through and diagnosed his ADHD with the conduct disorder. And basically, the whole point of her goal was to basically have some self-improvement along with the teachers and his parents understanding his symptoms and actually just mediating those. So basically, one of them that I liked was the where is it? It's here. Give me a second. To basically reinforce the reward behavior, but then also like say that you're not going to get this reward because of how you're acting right now, especially in identifying that it's a destructive behavior as well.
Yeah, and then her like goal for like the counseling too, which will help aid him in his treatment, is to have a secure bond and have someone that leads it versus I think having multiple people trying to butt heads in that way. Like he could have a secure bond with one person and only listen to what was going on between the two of them versus being told to do multiple things in different directions, which I think would add to his AD.
Right. And that's where that like whole concept of her branching that out, like, so constructed the treatment plan, but then she also pushed it towards like the parents and then the teachers for them to find that, okay, you got to be patient with him. You can't just punish him all the time for the destructive behavior. You have to kind of like tell him like how this is destructive entirely, but also towards himself, and all while rewarding him when he does things that are good. So that way it reinforces that bad behavior. Like, okay, we're not going to do this because if I do this right, then I can get a cookie or I can get a pizza or something like
I think it was more about helping them understand the areas of ADHD that he was still going to struggle with.
that.
So that way they're more aware. But I think sometimes it's hard to make those connections unless somebody makes that obvious to you. You just think that maybe the kid's acting out and he knows better, but it's still
Yeah,
helpful in those certain areas to say he's still going to struggle because of these other problems.
Yeah.
right. Okay, and then in relation to that is how reasonable did you find those goals that are provided for Naruto's counseling process?
I personally thought they were pretty reasonable. Just my own personal like thoughts after like going through all of the case, I thought they were on track.
Well, I
Yeah, I
think
agree, especially because I mean, working with kids in general, but especially things like ADHD and conduct, that you got to take bite-sized, manageable approaches while
Hmm.
also doing that sort of community education, like you were just talking about, and in terms of letting them know, hey, he's going to struggle with this. We're working on this thing first. Once that's good, then we'll bump up the goals, the outcomes, to something a little more that would otherwise be difficult or impossible for them. I feel like a lot of teachers and a lot of parents are just kind of looking at the final outcome, like the final expression, and it's one, well, I just want him to behave. I just want him to this, that, or the other. Um, and it takes sometimes breaking it down into small, let's do this, then this, then this.
Well, I think that even goes back to the first chapters where it makes that clear that in the beginning you're just talking about making the general changes
Yeah.
that'll help some of those symptoms. And then it talks about, and I was trying to go back to get it specifically as it's labeled, but then going on to actually making true progress as far as making internal changes versus just the small external changes to make progress.
Right. Okay, so as far as the next one, it says, what's the approach that Naruto's counselor select, and does it match that of the case conceptualization? I think from what I understood as her theoretical approach was that basically what we were talking about earlier is that like what you mentioned, Derek, the with his ADHD and CD, she basically took it as like a parent teacher intervention. So basically, she was informing them like one says, you know, the caretaker and teacher, psychoeducation, including I don't know.
Bibliotherapy.
Yeah, I was gonna say I'm not gonna butcher that. About the symptoms of ADHD and the use of medication. So basically, making them aware that it's not just he's acting out and he's being rambunctious. He's actually it's a cause of his symptoms, and that we have to explore areas of medication and different approaches and being a little bit more patient with him. That's what I kind of gained from that.
I think it was really good because it thought of all parties involved.
Yes.
Got
Right.
all on the kid. It's also involving everyone else. That's why I love the psychoeducation of helping people understand what they're working with. Not gonna
Yes.
say dealing with, but working with.
Especially with a diagnosis like ADHD or autism or like we'll maybe talk about in a minute with the DSM with gender dysphoria, where a lot of the problems, if we kind of take all the labels off of it, come from how others treat this person with the diagnosis,
Mhm.
Right.
right?
Just a misunderstanding completely
Yeah, the
of
stigma. Yeah,
these things. Because everybody should just be normal. There's some that,
exactly, exactly. You know, in terms of, for instance, Naruto wanting to be a ninja or pretending to be a ninja. You know, it as long as it doesn't interfere with his functionality, in a lot of ways, that's other people's problem if they find that weird or off-putting in some ways.
Right. Um, And I guess to relation of that is how effective you believe the approach is likely to be helping Naruto reach the goals for change.
I know using that approach, like including other people is like definitely like even in the video it's shared how like not only would like individual like working with the individual but working with like the families is going to be your best bet on getting the positive outcome. So I feel like you're going to have good outcomes with that approach selected.
Mhm.
I agree.
Alrighty. And then lastly it says what outcome measures were chosen by Naruto's counselor? And in relation to that, it says, do they appear appropriate for the selected target problems?
Yeah, so we have a measures of improved intention and concentration and impulse control. On his side, client, teacher, and parent improvements are have the same thing. Reports from them in terms of increased attention and impulse control, more awareness of Naruto's triggers for emotional and behavioral discontrol.
Right.
And then what we just talked about, the increased communication channels and increased relationships on everybody's part at school and at home, along with compliance with psychopharmacotherapy.
Yeah.
And I think
Big
the
words.
increased communication will be very good because that way, instead of just thinking your kid's acting a certain way or lashing out, you can actually understand what's going through their head and then and then help them understand why you're thinking the way that you're thinking, and it helps find common
Yeah.
ground better than not talking about the problem like at all, acting like there is no problem.
Yeah,
Yeah.
that might be the most important one.
Yeah, because like it kind of goes back to what you were like saying earlier, Kyle, is like far as like the stigma, because if we really want to think of it as a broad range, psychology in itself has evolved so much because
Mhm.
um even when I was going back for my bachelor's, there was I forgot what class I learned this in, but with kids who were born, excuse me, were born either with Down syndrome or autism in like the times of like when we were pioneers and whatnot, they would actually outcast the children. So they could be 5, they could be newborn, and they would just toss them into the woods. And
Yeah.
so seeing how we come so far as like this is the therapeutic intervention that the counselor wanted to use as far as like bringing in the teacher, bringing in the parent. Because if you think about it, it is so hard in yourself to admit that you have a problem and that you have to go and seek somebody else for help. So when you can rely on other people, especially when they're supposed to be so close to you, they can actually like help you identify other features that you wouldn't have even known in yourself and be like, okay, we're kind of reverting back to this. Let's get back on track.
Yes.
So that's what I liked about that.
Absolutely.
Yeah, I think we had a great conversation again today. I mean, we
Yeah.
always do. We had a great group. But I think we did really well today, guys.
That was a good
Yeah.
one.
The next one.
All right, guys. Thank you.
Yeah.